Hi, my name is Elisa Minkin. I'm a general pediatrician and I'm also chair of the JOMA Preventative Health Committee. And I'm really excited to be here today with Dr. Denise Moses. Hi.
Hi.
Dr. Moses is a board certified OBGYN. She is a true New Yorker, born and raised in Brooklyn. She received her undergraduate degree at CUNY Brooklyn and medical degree at SUNY Downstate. She completed residency at Hofstra North Shore-LIJ Health System. She currently works at a private practice located in Queens, New York called Healthcare for All Women. So I am so grateful for you doing this topic with me, which is basically going to be COVID, the COVID vaccine in the setting of pregnancy, fertility, pregnancy loss, nursing, all of these categories that so many of us are concerned about right now.
Yes, I'm excited to discuss all of these topics with you.
And I want to start with your story because you actually have a story to tell us.
Yes. So, as an OBGYN, I'll talk about my pregnancy in weeks. When I was 20 weeks pregnant, I found out that I had COVID. I actually was on call, was not feeling well, and was really doing my best to complete my 24-hour call without having to go home. That night, I had chills, had a sore throat, I had a cough, but I took my temperature and it was like 99.6. So I figured just a cold. Yeah. Tried to sleep it off, had tea, and tried to rest. But then I had an ongoing cough for a couple of days, and I decided to get tested. I actually had a very difficult time getting tested because this was very early in March, where at first they were saying, like, don't wear masks, it's not going to help you.
Just stay at home,
then,
just assume you have COVID.
Exactly. And I was actually refused testing at first because I didn't have a documented fever. But my my primary care doctor actually helped to convince urgent care to test me because I had a few risk factors. One of which was that I had a cough. The second was that I was a healthcare worker. And the third was that I was pregnant. And once I finally got tested and it came back positive, I was a little shocked because no one had really said that you could present without a fever. It ended up turning out that I was quite ill. Luckily, did not have to be hospitalized, but every few days I would have another symptom. I lost my sense of taste and smell. I had extreme fatigue. I had the worst headache of my life for days. I took Tylenol. I took an anti-nausea medication. I tried everything. Nothing helped it get better. Finally, after 21 days, I finally stopped having any more symptoms and started to feel more like myself again, but I was still exhausted. During those 3 weeks, once I found out that I had COVID, I was really concerned about my unborn baby because I didn't know anything at that point in terms of how COVID affects the pregnancy and what it could do to my unborn baby. After those 3 weeks, I still didn't have my sense of smell back. It took about another month for that to come back. But I was continuing to be monitored throughout the rest of my pregnancy with sonograms and discussions with the high-risk OBGYNs.
So what did you learn? I mean, that's your own personal experience, and that was your second trimester.
That was in my second trimester.
So I'm guessing that you researched it very intensely.
Yes.
More so than OB who didn't live through it. So can you tell us what you've learned about pregnancy and COVID? Because I want to put the setting, before we even get to the vaccine, we really have to understand that we're comparing the risk of the vaccine to the risk of the disease.
Exactly.
And the benefit of the vaccine to the benefit of the disease. And there is no benefit to COVID, so that's easy.
Exactly. I always say I'd rather not have it again,
Right.
no matter what. Um, those 3 weeks, I really thought I was gonna die. I remember, like, crying and just saying, like, "Why am I not feeling better? This is taking so long. I don't understand." Normally, um, any cold would take about 10 days to 2 weeks to feel better, and this was already a week beyond that. Um, at the same time, being so sick with this novel virus, not knowing the effect that it had on the baby, was frightening. And as an OB, where I see the worst case scenario, I was scared. Learning now about COVID-19 and pregnancy, we know that pregnancy is high risk um, for COVID,
Mhm.
meaning women that are pregnant that get COVID are at higher risk for intensive care unit admissions, need for mechanical ventilation, higher risk of preterm birth, higher risk for need for ECMO, which
Mhm.
is extra oxygenation.
Bypass.
Mm.
I've
Exactly.
seen it. Yeah, I've seen it happen.
Yeah. So we also know that the babies are at risk for being on the smaller side as well.
Mhm. Are there any other risks to the baby that we've seen or that
Um,
we know of?
as far as we know, no, we don't think that it causes any congenital anomalies in the baby. But we know that there have been some risks of intrauterine growth restriction, meaning a
Mhm.
smaller baby, and preterm birth, though it's unclear if that's because of the virus or because we're delivering moms who are sicker.
Mhm. Mhm. Now, the mother couldn't make it to term because she was too ill, and so they
Exactly.
had to deliver the baby. Well, she wasn't in labor; they had to deliver the baby early for the mother's sake.
Correct. Correct.
Either way, it's still a risk factor, in
Exactly.
all honesty. What
Exactly.
about transmission to the baby? I mean, I know
We
with chickenpox, for example, we have a concern with
correct.
the mother getting chickenpox at the very end and the baby not having antibodies.
We don't think that the COVID virus crosses the placenta or
Mhm.
affects the baby. So far, there hasn't been, to my knowledge, any information about the fetus being born infected with COVID.
Mhm. But the baby could get more severe COVID if the mother had it close to term, though. Have we seen that?
No, I haven't. I haven't. So
So
that's
we just
unclear.
don't know. I mean, a lot of things here where the answer is going to be, I don't know. It just hasn't happened enough times and been reported
Exactly.
for us to
Exactly.
know because this is a novel virus. So everything
Exactly.
here about it is new. So those are some of the risks, particularly to the mother, right,
Exactly.
during pregnancy.
Correct.
So you did get the COVID vaccine after, though.
Exactly. I did.
And
Very proudly.
at that time you were nursing, and what did you do?
I went home and I pumped right afterward because I was exclusively pumping,
Right.
and I was very happy to feed that milk to the baby.
Do we know
So,
of any risks to, because I get asked this already. I'm starting to get asked this as the parents in my practice are
mhm,
getting eligible for the vaccine and they're nursing their babies. What do we
there's no
know
risk
about
at all to the baby.
vaccinating a mother who's lactating?
Correct. No risk. Um, there is a theoretical benefit that if the
Hmm.
mom makes antibodies, those antibodies can be passed to the baby through the breast milk.
Now, if a woman has COVID while she's pregnant, does the baby become immune?
Theoretically, it's a possibility,
Hmm.
but again, we don't know yet. Because if the mom makes antibodies, it's possible that those antibodies will cross the placenta, and then the baby could be born with those antibodies, similar to the Tdap vaccine that's given during pregnancy.
Hmm. But that would be not something that would last very long because it's passive. It's not that the baby faced the virus, made its own
Exactly.
antibodies. It would be something that would wane fairly
Exactly.
quickly. So in terms of the decision to get the vaccine or not, because we're putting the decision to vaccinate in the context of COVID, and we talked about, particularly for pregnant women, they are high risk. What are the things we have to consider in terms of making the decision to give someone the vaccine who is pregnant, who wants to become pregnant, who's worried about their fertility. These are all different categories. So let's go through them one by one. Let's start with fertility because there is a piece of misinformation going around. So let's just go through that a little bit in depth about what that misinformation is and why it's wrong.
There was an article, a newspaper article that had come out with a very inflammatory title saying, head of Pfizer research says COVID-19 vaccine causes infertility. I might be paraphrasing.
We get the idea. Yes.
And when you look into it more, it wasn't the head of Pfizer research first. Secondly, the protein that they're saying this vaccine, which happens to be a new type of vaccine, it's an mRNA vaccine, which is a special vaccine that codes for information about the virus, and it doesn't contain any virus or any viral particles, is similar to a protein that is found in the human placenta called hesitancy. And the truth is that while it may share a couple of similar genetic codes, it's not enough to be similar enough to cause an issue with the placenta or an issue in fertility.
Have we seen a change in fertility during this pandemic?
There was a little bit of information, again, still uncertain, that there was a little bit of a decreased sperm count in men. 90 days after being infected with COVID. So the men that had the actual disease, not men that had gotten the vaccine, but it was transient and went back up after to a normal level. As far as I know, this is still being studied as well, and everything is sort of preliminary until we get more information.
Right. We don't know it for a fact. We have some evidence pointing in that direction. And it's interesting because I think that claims of vaccines causing infertility, this is not new for the COVID-19 vaccine. This has been claimed for many vaccines. And I think it's just something that is scary to people, right? But I've never heard a vaccine have the claim made that it causes male infertility until this one. And I suspect it's because there are, some evidence pointing to male infertility from the virus. And I think that the takeaway point of this is that people who are trying to scare you away from the vaccine, the tactic they use is they minimize the risk of the virus at the same time that they overinflate and distort the risks of the vaccine.
Correct.
So I think we always have to keep in mind what we're comparing here, that people are saying things like, oh, well, there's no long-term data. It's true. There's no long-term data. It's a brand new vaccine.
It's true.
Right?
But we have to listen to the science.
Right.
No science.
Right. And there's also a myth that there's been no reproductive studies done on animals. But there have been.
I don't know for sure. I think there have been. And I think
there have been.
The major issue is that women that were pregnant were excluded from the vaccine trials. There are certain groups like the Society for Maternal Fetal Medicine who actually advocate for pregnant women to be included in these trials. However, it's up to the companies that are researching this. And we know that some women have gotten pregnant while they were in the vaccine trials, and they're being followed up. And as far as we know, there's no adverse outcome with them.
Right. And back to the infertility claims. Again, there is no mechanism whatsoever of any validity that the vaccine could cause infertility in men or a woman. There just isn't.
Correct.
This is all, we talked about the myth, and everything else is purely just made up, not based on any science.
Correct. It's not based in truth.
Right. It's important to point that out. So back to, I said fertility, so we talked about fertility. So again, even though there's fears of it, the fears have no foundation. And in terms of the mRNA vaccine, and I say this in so many of my podcasts on this topic, I did one with Ellie Carmody, Dr. Ellie Carmody, who's infectious disease. I did one just now with Dr. Mark Mulligan. think at least one other that I've done where we've mentioned that mRNA vaccine, it scares people because it sounds genetic, right? The mRNA is just a message. The best example I heard is the Snapchat analogy.
Mhm.
Have you heard that one?
Yeah, I like that.
Yeah.
Why
It
don't you go ahead and tell
disappears.
people
It
about it?
disappears. The concept of the Snapchat message. I don't even,
Correct.
I'm so old. I don't even really 100% know what Snapchat is. I thought you were going to take over for me being younger than me and help me here. But
Let's try. All
Snapchat is
right.
this like,
It
is
just
this like
disappears.
social media thing, okay? And
It's
you
a
put it out
vanishing
there and it
message.
doesn't last forever, okay? It goes away.
Correct.
I've also
Yeah.
heard that the concept of the mRNA is it's so fragile that it has to be encased in the fatty, coating, which is one of the main ingredients.
Yeah.
I think it's the polyethylene glycol, which sounds very scary, but is a fatty type molecule that is actually there to coat it.
Mhm.
Same ingredient in Miralax. And that, by the way, is I think what's causing the allergic reactions, which is why God invented EpiPens. So all the severe allergic reactions that they've had, which is about 1 in 100,000, which is still pretty rare, have resolved with EpiPen.
Correct.
So back to that fatty coating, I've heard it described like an M&M, that if you held the chocolate in your hands, it would melt, and it's just a coating so it doesn't melt. So it can get into the cell long enough for the message to get through, like a secret message in a bottle, right? And then disappear. It doesn't
Exactly.
incorporate into your cell. It doesn't change your genetics. There's a lot of misinformation
It
about it, and
doesn't
it's
go into your
easy.
DNA.
Right. It's
DNA
easy to
is
believe
not to
that.
be changed.
Right. It's easy to believe that. We're not even talking about there's a whole other category that is not relevant yet because it hasn't been given an emergency use authorization, the viral vector vaccines, which I'm not going to get into, but the minute it is, we'll have to deal with that because
Exactly.
we are going to have alternative vaccines besides the mRNA ones. But the mRNA ones, yes, it's new. Yes, it hasn't been used for human vaccines, for disease protection. I think it's been used in cancer research. So the
Yeah.
technology
Yeah. The technology,
is not
I
new.
want to point out, has been there
Hmm.
and has been used. So just because it's a new way of using it
Mm.
doesn't mean that it's dangerous at this point because it has been used in the past. It's a
Right.
great way to protect people against a really severe illness that are both pregnant, lactating, and thinking about becoming pregnant as well.
Right.
Um,
And also, I think, for people who are concerned about ingredients in vaccines, this vaccine doesn't really have a lot in it because basically the message of the mRNA is the vaccine.
exactly.
It has very little in it. It's really a cool way. And again, we don't have long-term data. It's true. But again, you're balancing that against COVID. So some people will say, well, I had COVID. Why do I have to get the vaccine?
There's no guarantee. I mean, I had COVID too, but I
And yet
still
you
got
got
the
the
vaccine.
vaccine. Yes.
I still got the vaccine, and there's no guarantee that I wouldn't get COVID again. Um, there's no information really about how long the antibodies last, how effective they are. I know I was checking mine personally, and my antibody levels had actually gone down. I don't know what that means,
Right.
and I don't know if it actually even means anything,
Right.
but I would still want to protect myself and my family um, from getting sick again.
Right, right. Antibodies going down does not mean you're not immune because you can have memory B cells that can be, if you're actually faced with the virus. So lack of
Exactly.
them does not mean you're not immune. But the flip side, people don't realize is also true. Having antibodies does not necessarily mean you can't get COVID again. And I'm already hearing stories of this with really good testing where they still had antibodies and yet
Right.
they got sick. Why? Because the antibodies may be non-neutralizing antibodies. They may not be the antibodies that actually prevent reinfection.
Exactly.
So
So
we
why take the
know,
risk of getting sick?
right. And it's all a risk benefit equation. You may say, hey, I am on the front lines. I'm a doctor. Yes, I had COVID and maybe I still have antibodies, but I'm not taking a chance because I am getting exposed. Somebody else may say, well, what if I just stayed home? I mean, the problem is that I think people have to
Mental.
understand right now that we're tired.
Yeah.
We're in a state of pandemnesia, right? Where
Yeah.
we're almost pretending that there is no such thing
Yeah.
as COVID anymore because we've done it. We're
Yeah.
done
We
with it.
have
So
that
it should be.
pandemic fatigue.
It's
We're
more
all
than
exhausted.
pandemic fatigue. It's pandemnesia. I didn't make that term up,
I
right? But
love
it's
it.
it's it's a different pandemic fatigue. I'm tired. I really know I have to wear a mask. Pandemnesia means what pandemic? It's over, right? And there were, areas where the rate went down so much that they could, they could say at the time, oh, we have herd immunity. Well, they don't. But at the time, they thought they did. So this concept of obliviousness as it is skyrocketing out of control. And I think that's where the decision that we're really all at high risk,
Right. And
honestly.
that kind of thinking is actually dangerous.
Hmm.
It's actually dangerous, because people that can get exposed, they could be asymptomatic, and they could be exposing children, parents, grandparents, siblings, and people of all ages can get sick. And it doesn't matter if they're young or if they're old, both can still have very severe disease.
That's a really, really important point. And unfortunately, it's a very sad story recently of a 30-year-old who passed away from COVID. It's very sad. And we've heard this with pregnant women also. Like you said, pregnant women were at higher risk. We've all heard the stories of
Yes.
very, very tragic stories. So there's misinformation also going around that if you're young, you should not worry about severe COVID. It is true that the younger you are, and we're not talking about pregnancy because we already said pregnancy is high risk, but the younger you are, the greater chance you have of having milder COVID. But even in that doesn't mean that you're not going to have long hauler, post-COVID, all kinds of crazy stuff. And that is what we call the morbidity of the disease. People focus on the mortality. Well, how many people died? I heard this during the measles outbreak. No one died. So it's not so dangerous.
Right.
And yet
But what
we
about the
knew that
long-term
we,
effects? What about
yes,
quality of life?
right. We also knew that children's immune systems were shot like Swiss cheese from the measles illness that they had. So maybe they survived it, thank God, but their immune systems were shot. And COVID, people are so worried about what are the long-term autoimmune effects of the vaccine, for which, yes, it's true, it's theoretically possible, right? We don't know,
We
but we
don't know.
do know the long-term autoimmune effects of COVID.
The vaccine, most of the side effects occur within the first 6 weeks.
Right.
If someone's going to have a side effect, we would already by now know about it. For most of the people that were in the trials and for the people that have been getting vaccinated since the vaccine was rolled out, we're just heading into about 6 weeks now since the vaccine was rolled out. And we would know about more of the side effects. After 6 weeks, it's really unlikely to see any long-term effects from a vaccine.
Mm. I mean, I'm gonna be a little bit of a what's the word that I want? I'm gonna be a little bit difficult right now and say, well, how do you know, right? I mean, if you're talking about immunity, it could take time. I mean, I think that it's very reassuring that even those first 2 months of data are where we're going to see the vast majority of the acute and short-term type reactions.
Right.
But what I want to say for sure is true that we know that COVID has potentially devastating long-term, all kinds of systemic, whether it's autoimmune, whether it's cardiac, whether it's brain, whether it's, lung, all kinds of long-term serious quality of life adverse effects. So you're balancing known risk against a theoretical risk.
Exactly.
Because we're doing risk benefit weighing here. So even we don't have to say it can't be because it's only, it's been 2 months and it shouldn't be, because it could be.
It could.
It could be, but you always have to balance it
Working with the
against,
knowledge that we have.
right, with the knowledge we have, and we do know more about COVID. And so in terms of treatment of COVID, sometimes people will say, well, we can treat it now, or we can prevent it now. It's not true.
Right.
So that's a whole separate issue. And I'm wondering about what people plan to do if they're pregnant in terms of taking things like in some of these alternative protocols like hydroxychloroquine or Zithromax.
Right.
I don't think we have data on pregnant women with this.
Right. We do know that we do sometimes give Zithromax in pregnancy. For women who have preterm rupture of membranes. But is it better to take those medications while also battling a severe illness versus preventing the illness in the first place?
Right. And in terms of outside of pregnancy, we have no evidence that any of these medications are super effective. And I think the best medications we have are steroids, right? Which do work in more severe illness, but why would you want to have to take high dose steroids
Right.
while you're pregnant and already severely ill? Or,
Mm.
monoclonal antibodies, which have some efficacy,
Right.
but haven't been studied in pregnancy,
Exactly.
even though
Exactly.
they're a high risk category. I
So,
don't believe that pregnant women are on that list of people who are high risk. I don't know if that, I don't know this actually, if that's true or not.
according to ACOG, they are.
They
According to
are on the list. Okay, good.
the American College of Obstetricians and Gynecologists, pregnant women are considered high risk. I
Right, They're,
also
they're, they're high risk, but are they eligible for the monoclonal antibodies? And if so, how safe are they and how effective are they specifically in pregnancy?
that I don't
Right.
know.
We don't know.
Mm.
And even in other high risk groups, it has some efficacy of making the disease less severe. But again, prevention is so much better. And I feel like I have to say this in
Exactly.
every talk at some point, masking, distancing, masking, distancing. We're so tired of it that I have to say it because prevention, especially if you're afraid of getting the vaccine, but even if you're not, and people really want to take their mask off once they get the vaccine. And I already talked about this in my talk with Dr. Mark Mulligan. I'm like, I got my vaccine and I wanted to fling my mask in the air and like graduation cap, woohoo.
Yep.
And I said, no, it doesn't work like that.
Right. And also, the 95% efficacy is 2 weeks after the second dose.
Right. Right. And that 95%, by the way, isn't the theoretical, perfect, beautiful trials that they had. And we cannot have the expectation of having 95%. And we're
Exactly.
hearing, we're definitely hearing of more people getting it after the first dose, which should not be surprising, which should not be dismaying. It should not be surprising at all, right? Because we cannot expect, you know, at all full immune. I think it's 50% from the Pfizer, and I've heard higher numbers from Moderna, but I'm skeptical that those numbers are really
Right.
reliable.
And it's also
Again,
possible that they were already getting incubated with the COVID virus
right.
while they received the vaccine.
Right, right. Well, that's typical. But even after, if you don't have anywhere near 100% immunity, if you have 50%, and we see this all the time in the winter with the flu shot. I got the
Right.
flu shot and I got the flu. That's because you came in December and you sat in a waiting room and you got the flu from someone that you were sitting next to while you were waiting to get your flu shot. That's why. Or the
Exactly.
next day or the day after that. So that's reasonable expectations. I don't think we have enough data yet on people who had 2 doses. Because right now we're going to find out a lot very soon
Yeah.
because we are vaccinating a lot more people. We're up to like, I don't know, 9 million, 11 million in the US, I think,
Great. It's great.
right?
It's still not.
And COVID is rampant. So, I mean, I don't want to say that silver lining term even one more time, but it will make it easier for us to figure out what's going on. But we're also going to see a lot of COVID even after people are vaccinated,
Yeah.
even after the second time.
Yes.
So
And I
somebody in
want to say
Israel,
also, like, I was really lucky, having had it in pregnancy and
mhm,
not having had severe disease where I had to be in the hospital.
mhm,
So I was able to at least stay home, but that's not the case for everyone. And that's something that I also wanted to point out is the risk of having COVID and God forbid having severe disease versus the benefit of preventing the disease in the first place.
right. Right. So when we say prevention, I'm going to say it for the 9 billionth time. It's
Sure.
hand washing, masking, and distancing. Even if you've had the vaccine, even if you've had the second dose, my son will be so mad at me for saying this because he's like, well, then why get the vaccine? And I think it's that Swiss cheese approach again with, different layers of Swiss cheese and they each have holes. I think the vaccine looks like a very thick layer of Swiss cheese without too many holes, but it still has some.
Exactly.
And so why wouldn't you have the most protection, especially if you're high risk,
Exactly.
that you could?
I am still seeing patients in the office. I've had both doses of vaccine.
Hmm.
I've had COVID. And trust me, I am still wearing a mask and washing my hands and making sure as much as I possibly can not to get exposed again.
Right. And this doesn't mean that, some people will make fun and they'll say, oh, well, you're just so afraid. You shouldn't be so afraid. You should live your life. And I think it's just being careful. We have cars and planes, for example, have multiple safety mechanisms. We don't just have one and say, let's have faith that the plane will fly, even though the so-and-so isn't, being checked every whatever.
Right.
It's just being careful. That's all that it is. It doesn't have to be done with a sense of fear or anxiety. It's just things you do. And to the degree that we do them, then we're likely to get through this, right? But
It's reasonable to be hesitant about getting a vaccine of this sort.
right, right.
It's definitely reasonable because in our minds it is new.
Mm-hmm.
It is a new technology.
Mm-hmm.
And we know that the American College of OBGYNs, the Society for Maternal Fetal Medicine, other societies of reproductive medicine have been saying that women who are thinking about becoming pregnant should not withhold themselves from getting the vaccine. Women who are pregnant should have a conversation with their doctor, but there is nowhere saying that they should not get the vaccine. They're saying they should have a conversation about it. And women who are breastfeeding should be offered the vaccine as any other person.
Now, is there a wait period between getting the vaccine and becoming pregnant?
There is not. And if someone has gotten the first dose of the vaccine, finds out that they're pregnant, there's no wait on getting the second dose. They should get it at the appropriate time.
And there's no trimester where we say, oh, this vaccine is just not safe.
Correct. They're saying to offer it in any trimester.
And again, I mean, we're not here to provide medical advice. Talk to your healthcare professional. Everybody's going to be different. There are going to be some people who say, I feel that my pregnancy is very, very precious and I'm scared and I just can't do it. And to those people, I'd say, listen, it's your choice, talk to your healthcare professional, but please be careful. Please be careful. Take from this that, pregnancy is a high risk situation, that COVID is really rampant now. And now's the time to take as many precautions as you can. And I don't think that we have any evidence that there are vitamin regimens, for example, that are preventative. I'm saying this with all seriousness because many people do. You're laughing. Don't laugh. No, we wish it would be. We wish it would be so simple.
As healthy as possible. It's very important to be as healthy as possible. But a vitamin is not going to prevent someone from getting COVID. I take a vitamin every day.
Right. However much we would like it to.
But it's not going to be the thing that stops me from getting COVID. It's the other measures that I'm taking. Again, the masking, the hand washing, the being careful, the social distancing, getting the vaccine. Those are the things that are going to help me from getting COVID.
Right. And also other people in your family. I mean, you might say, well, I'm not comfortable getting it. We have this thing called cocooning in pediatrics where we have a baby under the age of 6 months and they are too young for the flu shot. So we say, please cocoon that baby by everybody around that baby getting the flu shot. Now, I'm not giving advice to people to not get it because they're pregnant. I'm saying you talk to your healthcare professional. We are not here for medical advice, but we are not judging here. We really are not. And it's understandable. I'm glad you brought up that point that it is normal to be scared. And everybody's decision, everybody's risk-benefit decision making is going to be different, right? So, if they did choose to, we're going to say, please be careful, and maybe everybody around you.
Exactly.
I mean, and again, it depends on so many factors. Like, are you a teacher and you can't avoid COVID? Well, then that's different than if you are somebody who's working from home and you can get your groceries delivered and you don't go to any simchas and so on and so forth. We're so tired of living like this, but somebody may choose to say, well, I understand that COVID is very common right now and it's very dangerous. And I learned that I'm a high risk, but I don't feel comfortable getting the vaccine. So we're talking about it. We're not, giving advice, but we are talking about it and not pushing. I don't want to have this conversation be, we're going to push the vaccine, no matter what, on every single person that's listening to this. We're not, we're giving information.
That's
so I think
all
that's
information that we have. And we are all trying to make the most informed decisions possible.
That's right. what about reactions to the vaccines? You know, I think that one thing that we have to keep saying about this vaccine so people are not taken aback is it is a reactogenic vaccine, meaning it is normal to expect some more significant side effects than you would get from a normal, typical vaccine.
So I do want to put out there that people are being watched after they get the vaccine. So they're being observed for about 15 to 20 minutes, depending on if they have allergies in the past, etc. I know I was observed for 15 minutes. Thankfully, I don't have any allergies. Just for any reaction or possibility or anything like that. We are concerned about anaphylaxis, which is a severe allergic reaction. And some people continue after they go home, have other side effects such as fever, malaise, arm pain.
I want to go back for just a minute to the, because I'm glad you mentioned the allergic reactions, because we only briefly alluded to them before, and that's important. Because I do have people saying, well, I have allergies, so I shouldn't get the vaccine. I mean, that's definitely not correct. Plenty of people have allergies and you can still get the vaccine. I think the only contraindication in terms of allergies is a history of severe reaction to the ingredients in the vaccine, which we think what's causing this relative increase in anaphylactic reactions, right? Because 1 in 100,000 is higher than the flu shot, which is 1 in a million.
Right.
So it is, we're hearing of it. It's a little higher. Is the PEG, polyethylene glycol, which is, I think, the emulsifier for the, you know, that to keep encase it. I think that's what it does. And so if you have a history of severe reaction to that, then you should call your healthcare professional, and probably, you know, you won't be able to get that particular vaccine.
Right.
But people who have allergies, that is not true. And even for the people who've had these reactions, they have all recovered with EpiPens. Now, what I meant was by reactogenic, I meant the side effects. And now I'm going to let you go back to the side effects and how it would impact on someone who was pregnant.
Correct.
Or nursing.
Correct. So most of these side effects are easily handled with a little bit of Tylenol or acetaminophen, same thing, especially if someone has a fever. And I took Tylenol after my dose when I was having my arm pain and a little bit of my tiredness and just overall not feeling great. And within an hour, I was back to normal. And I can say now it's been a week since I got the second dose, and I feel totally fine.
And that's not, as opposed to Motrin or the non-steroidals, because you're nursing now.
Correct. So but Motrin is still safe while nursing.
Right. Okay, so make sure that people, and for a pregnant woman, I think they can only use the Tylenol, acetaminophen category, not the non-steroidals like Aleve or Motrin or any of the ibuprofen type categories. But there's still that good old Tylenol there for you. And what about, we're going to talk about this just for a minute, not get too deeply into it, but what about someone who says, well, what if I get a fever and I'm pregnant? Wouldn't that be like dangerous? What do we know about that?
So there have been some studies that there may be a risk to women that have had a fever during pregnancy, especially in the first trimester, of neural tube defects. It's been shown that taking 400 micrograms or more of folic acid mitigates those effects. And we also advise our patients to take Tylenol if they have a fever.
Right, so those micrograms are in the prenatal vitamin.
Correct.
Which they should all be
taking. It's usually more than 400.
Right. Just so people know, that's not some weird thing. That's something you're taking already.
Correct.
While you're pregnant. So
that's a good vitamin.
It's a good vitamin. Unless you have something to add, I feel like we went through the main. The main concept is really very simple. If we continue to call this by the topic you came up with, which is, should you be more afraid of COVID or the vaccine in pregnancy and nursing? The answer is clear. It's you should be more afraid of COVID.
Yes.
That's simply what it is. And everybody should be careful. And, we're so close. I have one more thing I just want to say, which is that I have this analogy, I have this mashal of we're in transition, the stage of pregnancy, of labor where you're about to deliver. And how does a woman feel in transition, right?
Yep.
like she can't do it anymore, like it'll never be over, like she needs an epidural. So I want to tell everyone we're almost there.
We're
We're the
almost there.
last, we're
If
the
we work
last little
together.
bit. We just have to be, be careful. And of course we have to dive and touch them for help. And we should really strongly consider this vaccine because we're really, really fortunate to have it and getting it out there.
Yes, we are very fortunate. We are very fortunate that we have scientists that came up with the technology, and are very fortunate that we're able to get it out as fast as we have been as well.
Right. And we're going to continue to learn about it. And, fortunately, despite the fact that there is misinformation circulating fast, there's also a lot of good information. And, for people who say they're hiding things from you, we're all taking the same vaccine, the same one that we're offering our patients. You took, I took.
Exactly.
There's no
Yeah.
special vaccine. There's just
I
one.
wouldn't do anything to put my children at risk.
Right. And neither would I or my patients
Exactly.
families. It's the same
Exactly.
vaccine. And, there is a lot of transparency. All of these things you can look up online. You can find out information about it. Um, do you have any resources to give people who want to look into this more?
Yes, let me pull up my website,
Amazing.
um,
I love getting it.
acog.org.
ACOG.org.
Correct. And it's a practice advisory called Vaccinating Pregnant and Lactating Patients Against COVID-19. Very important.
And I'm going to mention, just for people who heard something that they want to look it up, there is a very good website called Vaxopedia. Vaxopedia is like the Wikipedia of vaccine misinformation. And yeah, so if you've heard that sensation one myth, you can look it up and it will tell you.
Exactly. The truth.
It will tell you, it'll give you links, it'll give you the information, and you can see it for yourself.
Yeah.
So people should not have to feel overwhelmed. It does feel scary to have something new. It does feel overwhelming to have this surge of both information, misinformation, disinformation, and not to be able to know who to believe. But I hope that, people see that a lot of us, you and I including, are trying to get good information out without trying to push anything on anybody and trying to be, as honest and transparent as we can be. And I thank you so much for doing this with me.
Pleasure. I also wanted to add that the CDC has a vaccine reporting website after people get the vaccine.
Yes.
It's called vSafe.
Mm-hmm.
Very important to help everyone kind of track their symptoms after getting the vaccine.
Right. There's also the vaccine adverse events. There's also,
Yeah.
active and other databases. There's lots of databases, but the vSafe, I think, is something you can put on your smartphone.
Yes, it texts you when you're supposed to log in with your symptoms.
Right. So we really are trying to track, and to the degree that everybody cooperates and tells what happens, we'll even know more.
Exactly.
And the news media is going to jump on every single case. So don't worry.
Knowledge is power. That's it.
We're going to hear it. We're going to hear it. And hopefully we're going to hear more good things. And I thank you so much for doing this with me.
It was a pleasure.
Thank you.
Thank you.
Okay, we're doing something really unusual. We're going to do an addendum to our talk. And the reason we're doing this is because just 2 days ago, the World Health Organization came out with a statement about the Moderna vaccine. And they basically said that they are not recommending the Moderna vaccine for a pregnant woman. That's the short statement that the news media has taken and run with. And so we really need to do a deep dive into that statement to put it in perspective. Nothing we have said in this talk has changed. Nothing about the decision-making for taking the vaccine while pregnant has changed. We just have to put this statement into context. So I'm going to let you tell us a little bit more about what the World Health Organization said, more than just that one line, to put it in context, first of all. And it's similar for the Pfizer. So when people say, what about the Pfizer? The answer is, it's really the same thing.
Correct.
They didn't recommend it for pregnant women either. It's not like they recommended the Pfizer, but not the Moderna.
Exactly. So the WHO, the World Health Organization, put out actually yesterday a statement saying, what you need to know about Moderna COVID vaccine. So they're talking about who can take the vaccine and who should not take the vaccine. Mm-hmm. So under this Moderna statement, it's saying while pregnancy puts women at higher risk of severe COVID-19, the use of this vaccine in pregnant women is currently not recommended unless they are at risk of high exposure, like healthcare workers. On January 8th, I apologize, they put out a statement about the Pfizer vaccine saying who can take the Pfizer vaccine. And again, it says, pregnant women are at higher risk of severe COVID-19 than non-pregnant women, and COVID-19 has been associated with an increased risk of preterm birth. However, due to insufficient data, the WHO does not recommend the vaccination of pregnant women at this time. In case a pregnant woman has an unavoidable risk high of exposure, example, a healthcare worker, vaccination may be considered in a discussion with their healthcare provider. So those are the main talking points from these two WHO statements. I wanted to point out, it's not just about the Moderna. They also included Pfizer, and they're essentially saying there's not enough data to recommend vaccination for a pregnant woman unless she's at high risk, for example, being a healthcare worker. However, ACOG, which is the American College of Obstetricians and Gynecologists, and the Society of Maternal Fetal Medicine, put out a statement today, January 27th, saying that they are aware of the WHO recommendation to withhold COVID-19 vaccines from pregnant individuals unless they are at high risk of exposure. ACOG and SMFM continue to stress that both COVID vaccines currently authorized by the U.S. Food and Drug Administration should not be withheld from pregnant individuals who choose to receive the vaccine. They are not changing their guidelines.
And SMFM is the Society for Maternal Fetal Medicine.
Correct. Yeah. So those are the doctors that take care of our high-risk pregnancies. ACOG are the doctors that take care of all the other pregnancies and deliver the babies. So these are the people that have both the mom's life in their hands and the fetus's life in their hands. And their recommendation is to continue to get the vaccine.
That it should be available. I mean, say not to withhold means
Correct.
They can get it. I mean, I think
Correct.
that we can look at them and hold them both on our mind at the same time and say that the decision we're making is a decision in uncertainty. They're both agreeing that it's not like we have
saying.
Yeah, all along.
All along, this is what we've been saying.
Right, but we have tremendous risk from COVID itself, which is very prevalent and mutating and, becoming even more infectious in its, newer incarnations, unfortunately. So it's not like you are only facing the risk of the vaccine, you're facing the risk of COVID while pregnant, which can be a higher risk. So I think it's reasonable to say that we have the same situation. It's not that we should be so gung-ho and say every pregnant woman should get this vaccine, no questions asked. No one should say otherwise. Then they're an anti-vaxxer if they say otherwise. That's not true. It's very reasonable to have reservations, and everybody's situation is going to be different, and that's okay. So this is not an earth-shattering statement. The media always takes things, for the effect, for the shock effect. Right? They're not
and it blows some things out of proportion.
It's blown out of proportion. They are not saying it's dangerous. They are saying because we don't know, we can't recommend it.
We don't know enough. And that's what we've been saying all along. And that's why it has to be a conversation between the woman and her doctor.
Right. I think some have said they don't even have to. If they want to, they can make that decision on their own. It's not like a situation where you must be cleared by your doctor to take the vaccine if you haven't been checked. And what if your OB's against it and you're for it? Right? Because I think people are going to have different ways of weighing the risk benefit, different ways of making decisions in uncertainty.
Exactly. Women can make their own decisions. They should definitely have a conversation about it, but in the end, it's their decision, no matter which way they decide to go. And it's perfectly okay to be unsure, but we have to take the statements at face value, meaning there's not enough data. There won't be enough data for a while until all of the studies are completed. we're working with what we know. We know that COVID is dangerous. We don't have any data really about COVID vaccine in pregnant women, but if women are at high risk of exposure, the vaccine should not be withheld.
Right. And as we do more vaccines, we're going to have more and more women who are pregnant. You know, again, the pregnant women were excluded from the trials, which is a point of contention, right?
Exactly.
From the ACOG,
Exactly.
from these organizations. So like if you had just
Exactly.
studied this on pregnant women, we would have the data and we'd have a high risk population that wouldn't be so vulnerable. It's
Exactly.
maddening. It's maddening.
Exactly. They've advocated for pregnant women to be included in these trials, and unfortunately, it's not the case right now.
Right.
So I do believe that there are some trials that are going to include pregnant women in the future, and some trials on rats have not shown any issues or deleterious effects.
Right. I think they've even studied rats while pregnant.
Yes.
I know
Yes.
they did that for the Moderna. I don't have the exact details, but I know that the so-called DART studies, which stands for, I think we've had this conversation already. The DART studies, it's
No.
reproductive, developmental and reproductive,
Technology, maybe.
no, toxicology, I don't know. Anyway, whatever DART stands for, they are animal studies that were done. They were done for both Moderna and Pfizer. Don't have the exact details about that, but there have been some studies and people with, you know, more interest. All of this is out there and transparent.
Yes.
So you
Yes.
can, if you needed to get more data on the animal studies, but animals aren't people.
Exactly.
We don't know. We have to be very transparent about what we don't know. And the World Health Organization has taken what you might call a conservative stance that if we don't know, then we're not going to recommend it. Very controversial because a lot of us feel that they're not weighing the risk of COVID against the theoretical risk of the vaccine. We have the actual risk of COVID, which is still very high. It's not like we're not in the middle of a pandemic. It's not like a disease where the incidence is low. It's rampant.
Huge problem, as we discussed before. It is a huge
Right.
problem, and it is a huge risk for pregnant women and their babies to get COVID.
Right. And this would especially be true for a pregnant woman who has comorbidities, you know, has other disorders, whether it's that she's, you know, starts with her pregnancy with a significant higher baseline weight, whether she has, you know, pre-existing medical conditions, whether she has gestational diabetes or hypertension or any of these kind of conditions are going to put her at higher risk. And again, these are the risk-benefit decisions in terms of making it that can be individualized.
Exactly.
For the individual person. So we're going to leave with this. Hopefully this will help people to put the World Health Organization statement into context and wish everyone hatzlacha in making a decision that honestly, it's difficult, you know, it's difficult to make these decisions with uncertainty, but
Don't
that's,
forget social distancing,
yes, yes.
masks.
Right, and that's the other thing. If you choose to, if you're able to stay away, and by the way, if you, it's not just doctors that are high risk of exposure, it's all kinds of people who do all kinds of jobs. But if you're working from the home, and I think we said this in our talk, if you're working from the home and you're able to distance, that puts you in a different risk category than someone whose job pushes them, you know, to be with people all day long.
Exactly.
So I'm saying goodbye to you for the second time. Thank you so much for doing this with me.
Thank you again. Take care.
You too.